Anxiety disorders are a class of mental disorders that distinguish themselves from other problems with two key features: fear and anxiety. GAD is a specific type of anxiety disorder. The hallmark feature of GAD is persistent, excessive, and intrusive worry. People with GAD will often describe themselves and their lives as always feeling anxious or on edge. Younger individuals worry more about school performance, whereas older individuals will focus more on physical health, finance, and family well being. Some general fun facts about anxiety is that women are about twice as likely to develop GAD in their lifetime as men. So both genders are highly likely to develop anxiety, specifically GAD, in their life at some time. It is among the most three psychiatric problems in young people. Onset anxiety disorders can put children and teenagers at greater risk of other psychological problems in their adulthood. Approximately 20% of the youth in the general population struggle with some kind of anxiety disorder. And about 3% of American adults have GAD. Only about 43% of people with GAD actually get treated. And in order to be diagnosed with GAD, the DMS 5 specifies that a person must be experiencing GAD symptoms for at least 6 months in order to be appropriately diagnosed. Worries in children and in adults both are different, yet they both tend to typically be about certain life circumstances. So, one important thing about having GAD is learning how to deal with the constant anxiety and symptoms. Although every person has a different experience with GAD, the symptoms that they experience are all similar, such as muscle tension and body aches, as well as the constant worrying and obsessive thoughts. There are different types of treatment for GAD. There's therapy, such as psychotherapy, which is known to improve the symptoms of GAD substantially, as well as medication, so traditional anti-anxiety drugs, as well as antidepressants. These medications only help to cope with the symptoms, but are not an actual cure for GAD. Some coping methods, at least physically, are getting involved. When a person begins to feel anxious, it is common to become isolated and disconnect from the people around us. And by doing that, it honestly worsens the way the individual feels, because now they begin to feel removed from everyone, or they feel removed from the family, or they feel removed from their community. People with GAD need to put an effort as well to find certain activities or events that will help foster a sense of belonging and allow them to feel purposeful. Talking to a trusted individual can help bring peace of mind. Anxiety can lead people to believe that they are alone in their experience and that no one can ever understand how they feel. By opening up about their struggles to others doesn't just allow for them to talk out their feelings and get that peace of mind, but it also allows for others to feel comfortable to open about their struggles, all at the end being able to help each other get through their anxiety issues. Another useful technique is mindfulness. And if not mindfulness, praying or deep breathing, which helps slow down anxious feelings or thoughts, constant thoughts or emotions that bring anxiety into our mind. By slowing down, we learn to live more in the present rather than always worrying constantly about the future, which anxiety likes to budge into our lives. Anxiety will make you constantly think about the future despite there not being a threat. It'll make you worry, although there's no reason for you to worry about it. So by slowing down, you learn to not worry so much about the future, but in a way, learn to live in your present. Another helpful technique, as you're learning how to slow down and become more mindful, is to pay attention to situations that'll trigger your anxiety. Although you will not be able to avoid these triggers, it is nice to realize them and know them, so when you are in the moment dealing with this, you can find a way to manage the stress during these specific situations rather than just blowing up and just straight up just having a panic attack or something. At least in a way you can try managing how to calm yourself down rather than just going crazy. Another important thing to always remember is acceptance. That it's not your fault that you're like this. It is not something you are experiencing because you are flawed. Anxiety is influenced by many different things: genes, neurobiology, your family history, the experiences you have in life. It will help you you or a person you know who has general anxiety disorder to learn to accept this journey. Although it will be hard, accept the journey and embrace it as an opportunity to learn about yourself, but also as an opportunity to learn to care for yourself in healthy ways so that the anxiety can slowly not be as triggering or hit you as hard as it would if you don't learn how to accept this. Lastly, I want to touch a note on recovery. Recovery in general is not easy, especially dealing with any kind of illness, even especially mental illnesses. But it does take effort and a desire to become better. If you want to feel better, you need to put the effort. You need to have the desire to be better. And even though you become better, sometimes you won't fully recover, and that's okay. And anxiety will probably be in your ongoing life forever. However, if you slip back into old habits, you have a much higher possibility of the anxiety worsening or coming back from how it used to be to now. And that is my video on anxiety. Well, generalized anxiety disorder. Thank you.